This episode is going to give you a new perspective on your pet's dental health. The hidden pain, the parts of the mouth that we simply cannot see, and why waiting too long can affect far more than just their teeth. Today you'll understand the difference between brushing, a quick clean, and a proper veterinary dental, and why anesthesia is safer than many people believe, and how dental radiographs can change everything. I'm your host, Dr. Kara, a veterinarian who believes preventing pain is one of the greatest gifts that we can give our patients. My guest today is Dr. Morten Hinge, a Danish veterinarian who built Morten Vet Dentist, an educational platform teaching vets worldwide how to perform safe, efficient, and welfare-centered dentistry. If you enjoy this episode, please like, share, and follow to support more credible veterinary conversations. Now let's begin.
This is the most important thing about dentistry. All the disease is hidden and there are no clinical signs. They still eat despite all pain, they still wag their tail. Everybody's heard this from an owner. Well, it still eats, so it cannot be painful. This is the biggest misconception out there. I've had dogs with jaw fractures, big abscesses, and they still eat perfectly fine. You know why they eat? Because they're hungry, they need to survive. They don't have this instinct of if they stop eating, what will happen? They will starve.
So you have an interest in dentistry. Where was it born? Why this field?
Well, I think it started after graduation. I've always liked surgery. And I thought I was going to be a knee and back surgeon and doing these types of surgeries, just like everybody else within surgery. So I took a couple of months off, and I went to a specialist practice in Indiana, United States. I used to be a foreign exchange student in the US during high school, so I went back to my old city, and I stayed at this practice to shadow a board-certified surgeon. And while I was doing that, even though I learned a lot about knees and backs, I also saw one day that an old patient came in with a dental issue, and they really didn't have much clue what to do about it. And I was just baffled, like, okay, this specialist that is doing amazing, fantastic surgeries don't have much knowledge about dentistry. I thought, this is odd. And one day another dog came in, and it needed a molar extracted from the mandible. And even though they had all the fancy equipment for backs and knee surgery, all they had was an old, dull elevator to do this. And this expert surgeon attempted to extract this lower molar tooth. And I had to look away because it was just, the ginger was just becoming minced meat, and it was really bad. And I thought, okay, my help is needed here. I need to. This is something that obviously requires more training. And dentistry is like a specialty surgery, but no one taught you how to do it. And this really emphasized that we never learned this in school. So I thought, okay, with dentistry, because every day there would be a dental patient on my table. And it is a day one skill that is required and expected. Once you're done as a veterinarian and you get your first job, at day one, you may have a dental patient on the table. And your boss and the owner expects you to do what is needed. And I don't know about you guys, but I have an idea that most of us didn't learn anything about dentistry in school. I got to scale and polish a quarter of a mouth unattended while the instructor went for coffee. That's my training. Maybe some of you out there has the same amount of training. So the skills required for dentistry is something you learn after school. And so you have to have a certain interest in learning this, because a lot of vets that I know, they simply dread dentistry and they feel this knot in their stomach when they have a dental patient on the table, because we want to do a good job. We want to do the best, right? But we don't have the skills. We've never learned how to do it. At best, we may we may have extracted one incisor in a cadaver or polished like some teeth, but we never had like formal, really good training on how to do it.
Very much so. And I mean, that learning in theory, even though you may have sat in a lecture saying, you know, these are the tools you use and this is the technique, is very different to actually the practical application of that. And the results are either a success or a failure in it. And obviously it becomes more and more stressful when you're not getting it right, and it becomes something that you then avoid. So can we first talk about, I'm going to go back to the very beginning because I've got so many questions for you. So please bear with me.
Sure.
Because I do find it personally very interesting. One of the things we obviously have to recognize is, and we'll do this hopefully at the end in terms of how owners can try and prevent dental issues longer term by being proactive, but we'll leave that right for the end because that's, you know, hopefully basic competency that we can guide owners.
Yeah.
But often what we're faced with is we see patients that come in and they are normally geriatric. Sometimes they have underlying disease. And here we are as veterinarians saying, this pet really needs a dental. And then owners go, oof, well, what's that going to cost? And then it becomes a conversation of trying to manage the cost associated with it whilst getting a minimum database, including, you know, bloods and explaining an anesthetic. And now, obviously, with a lot of practices having dental radiographs, trying to justify the cost of taking those radiographs. So I want to start at the very top level of how do you go about having these kind of discussions with owners to explain and really not convince, because, you know, this is the difficulty, but try and inform them so that they are invested in doing it.
I know exactly what you mean, and this is the most important thing about dentistry. It's not really learning. The first step, the first thing you need to learn about dentistry is not how to extract a tooth faster. No, it's actually client communication. It's how to convey to the owners their dog have a problem. Because I think vets doing dentistry, they have a much harder job than vets checking out dogs for other problems. Because every day you have dogs walking into the clinic that's limping, and the owner is like, my dog is in pain, it's limping, you need to fix this right now. Okay, we need this, and let's go. With dentistry, they don't come in saying, I think my dog or cat has an oral problem. No. And most of the time we find these problems when we are examining the mouths, like through when we're doing vaccinations or other appointments. So we have to tell this owner that brings in this perfectly healthy looking dog that is eating like normal, is wagging its tail, we have to convince them that this dog have oral pain and we need to spend several $1,000s on fixing it. That's why trust is the big thing here. How do we get the clients to trust us and to demand that we treat it and to want our help? And this is the really big difference with dentistry, because all the disease is hidden and there are no clinical signs. They still eat despite oral pain, they still wag their tail. Everybody's heard this from an owner, well, it still eats, so it cannot be painful. This is the biggest misconception out there. I've had dogs with jaw fractures and big abscesses and everything, and they still eat perfectly fine. You know why they eat? Because they're hungry, they need to survive. They don't have this instinct of, you know, what if they stop eating, what will happen? They will starve, and so they won't let you do that. So the way I approach this is when I started as a vet, when a dental patient was admitted, it was admitted through the reception. So the owner would come in the morning with the dog and say, here's my dog for the cleaning. Call me when it's done. Okay, bye-bye, see you. And that's the amount of information, communication we had with this owner. So what happens is they delivered a perfectly healthy-looking dog for a cleaning because they thought they just want to. Somebody told them they needed to get the tartar taken off. So you get this dog on the table, and the typical thing happens is that you find multiple teeth that need extraction. And now you have to call this owner, and you've never met this person before. So some stranger from the clinic suddenly calls this owner and say, hey, this is Dr. Morten. I found 15 teeth we need to extract. It's going to cost you €2,000. Do you want it or not? This is not the ideal way to do it. I've done it myself, and I failed miserably in the beginning until I learned how to turn things around and make them trust me. So when you do this to an owner, they will feel pressured with good reason, right? And it's not a good experience for everybody. What they thought would be a routine cleaning suddenly was a multiple $1,000 procedure on a dog they thought was healthy. And so this is where the complaints start to come in, and this is where you have to spend a lot of time with frustrated owners after explaining why it was needed. So there's a much, much better way to do it, and that is by setting aside 15 to 20 minutes every morning where you personally, you or your lead technician who's doing dentistry with you, are taking this patient in and talking to the client. So what you need to do is, first of all, you have to establish trust. So walk up to this owner, establish eye contact, shake the hand if the Corona regulations allows it. Oh, walk up to them, look them in the eye, shake their hand, and tell them, hi, my name is Dr. Morten. I'll be your veterinarian today, taking care of Bella's dental issue. So let's use 10 minutes in this room and talk about what we're going to do today. Is that okay? Yeah. Then they go in. Then you ask them about, what's going on with this pet, and then you take the pet onto the table. That's when you lift the lip and have a look inside the mouth with the owner. This is very important that you look with the owner. You lift the lip and you look for gingivitis, which is red gums. You look for, obviously, tartar, other signs of disease. And when you find something, make sure that you point it out to the owner. Say, can you see this red gingiva here? This is actually infection. This is gingivitis, meaning you have bacteria infection around the teeth. And they'll be like, oh my God, infection. Then you need antibiotic, right? No, that's another discussion. You don't actually need it because periodontitis is a surgical treatment. So once they see this, and you already established trust, you showed them that you care, that you talk to them, that you petted their patient and their dog. They can feel that you like the dog, you like them, and you have this conversation about what is going to happen. And I have 4 pictures that I use to explain the procedure for every patient. So in every consultation room, I have an A4 sheet of paper with printed out pictures. And these pictures show a normal looking tooth. And then on the next picture, I have my probe that's going into the gums, 5 millimeters down. And below that is the X-ray, where you can see all the bone loss that is actually can be present in a tooth, that it looks completely normal on the surface. So the way I get owners on board with dental X-ray, because dental X-ray is the most important diagnostic test we have. Because if you do not take dental X-ray on every single patient, you will send every 3rd patient home with disease that is painful and needed treatment. That is statistically proven. And I don't want to be this vet who sends home patients with uncovered disease. And if you explain this to the owner, they don't want you to send it home with disease that was not found. So what I do is I tell them, you asked about price, how can we convey this extra cost to the owner to make them say yes to this and understand the value of it. So by setting aside time in the morning, we make them understand the value by showing them why we take X-ray on these pictures, these 4 pictures, instead of asking if they want X-ray. That's a major difference, because if you start to say, so the cleaning today is going to cost that. If you'd like blood tests before, it's going to be additional this. And we also recommend taking X-rays, and it's going to cost this much extra. So How much of that do you want? And asking the pet owner about this does not make any sense. To me, it's kind of like asking when you take a blood test, you ask the owner, do you want us to run creatinine with that? It's going to be 20 euros more. And they'll be like, why are you asking me this? You're the doctor, right? And we know we need it to uncover kidney disease. Not all dogs have kidney disease, but if we don't take it, we'll miss a lot of disease. So it's the same with X-ray. It doesn't make any sense to ask if they want it or not, because we know deeply inside that we need it to find the disease. So the way I say it, I say, so for today, for the pre-op blood test, the cleaning, the polishing, the oral diagnostics, the full mouth X-ray, the price is going to be this. And then you wait. And if the owner passes out, then okay, maybe you can talk about, do we need the blood test or not? For me, X-ray is non-negotiable. And the moment that you tell them why you take X-ray and show them why on pictures, instead of asking them if they want it, this is the major shift where you will experience clients will suddenly magically accept it every single time. For the last about 10 years doing dentistry, all of my patients have received dental X-ray, and I've had only maybe 1 or 2 clients who refuse to have it done. And so it's all about how you speak to the owner about this, not make it optional. And then the vet out there will say, yeah, but if we include it on every patient, the clients will not pay for it and we will lose clients. We'll lose this client. So my experience, I've turned around 3 different vet clinics where they didn't take full mouth X-rays as a standard. When I was hired and starting doing dentistry, all the patients, it was a non-negotiable. So it's all about like how you speak to the owner about. You say, I can see here last time when you were in with my colleague, we did the cleaning. They didn't do full mouth X-ray, and then I will say, so how do you move on from that to, oh, now you suddenly need X-ray. You didn't need that last year. So you say, well, every day we got smarter. We get smarter. We learn more, and we've simply learned that if we do not take full mouth X-rays on every patient, we will send home every 3rd patient with disease. I don't want to risk sending your patient home. And they agree to that. Will everybody pay for it? I think it's important to communicate the price before, like when they actually book it. When you find the disease during vaccination, that you actually have a paper that you say, this is what we recommend. Oral examination, X-rays is going to cost this. You can go out and book time for it. So don't make the price a big surprise. And my sense is that yes, you may lose some clients who don't want this, but your dental schedule will be more booked than ever. You won't lose like bookings. And I've experienced that clients come to me now because they say, my own vet do not take full mouth X-ray. And we know this is important. So we come to you because you do it. And this is the new shift I'm experiencing with pet owners. They are getting more and more informed. So the problem is that they were not informed before because the vets were afraid to talk about it. They're afraid to offer it. They're afraid to make it non-negotiable. And I feel 100% confident that if you do this approach, it's worked on several clinics. And also the vets I'm teaching in my courses, they do the same approach. And it simply works. The clients are happier. You get more referrals by word of mouth because they got a good experience. You found the disease that was present. You communicated in a very respectful way. You set aside time in the morning to speak to them about it and inform these clients. Because none of these questions the clients ask, like, well, how can it eat if you remove all those teeth? And it's too old for anesthesia. And all these things that they tell us, this is not an attack on your integrity. It's because they need information. Nobody gave them that information. And it's our job to just respectfully say, okay, this is actually not the way it is. This is the way it is, and inform them. And I think this is the big shift, that if we do this approach, we'll have much more success with dentistry. And all of this I've spoken about, none of this has been about how to extract the tooth faster. This comes after.
No.
You have to talk.
Yeah.
You have to be able to gain the client's trust, and this is what worked for me.
Very interesting, and I totally agree. You have to not surprise owners, allow them to sort of have managed expectations around the procedure and feel that they're informed and invested in the decision making. I think that would make the world of difference.
You look at me, I look at you, I see the love in your eyes.
Health you can see, love you can feel. UltraPet, the science of love.
When you're explaining to owners or even vets in terms of the diseased tooth, can you take us through what happens in sort of over time in terms of the progression of dental disease if you're not managing it?
Yeah, so the most common oral disease in dogs and cats is periodontitis, and cats, tooth resorption. And periodontitis happens, it starts already by age 1, and some dogs below age 1. I've extracted a molar on a 9-month Yorkie that was rotten because of periodontitis. So this happens so quickly. The smaller the animal, the more oral problems it have. Usually because the teeth take up a proportionally larger space of the mouth, and in those small breeds, and there is a genetic correlation too, like genetics play a role and the size of the patient. So we know that at year 1, close to 80-90% of all dogs, they do have oral disease in the beginning. And by age 2, it's most of them. So why does it happen? Well, it's mainly because of plaque. And plaque is a normal thing that is attached to our teeth as well. If we don't brush our teeth daily, we can feel this layer of white plaque. It's the same on dogs. And some dogs can deal with the plaque and tartar, others absolutely can't. That's why you sometimes see a 12-year-old German Shepherd with lots of tartar. And once you get off this tartar, when you remove it, everything looks perfect below. Then you have a 2-year-old Bichon Havanese with just a little bit, tiny bit of tartar, but raging gingivitis, pockets, periodontitis, loose teeth. And so the individual response to plaque is different from dog to dog and breed to breed. Larger breed dogs, their problems is usually fractures because they chew on inappropriate things. So we know that from a young age, they develop a reaction to the plaque, which starts with gingivitis, so that's the red gums. And this will progress if not handled at that stage, gingivitis, then it will progress to periodontitis. Periodontitis just means perio means around, dont is the tooth, and itis is infection, right? So infection around the tooth. So it's not dental disease, it's not the tooth that is diseased, it's the tissue that is holding the tooth in place in the jaw. That's what gets infected. That's why you start to see loosening of the tooth once it gets severe enough. So once periodontitis is established, then it will progress quite fast. Sometimes within 6 months, you have a tooth with, let's say, 20% bone loss, vertical bone loss, and 6 months after, you are at 50%. That's an extraction. And this is how fast things progress. And I typically tell owners that it's kind of like, 1 dog year equals 7 human years. So this is how fast things are progressing. Imagine you didn't go to your dentist, like you go once a year. This is like the dog only going to the dentist once every 7 years if you have a yearly cohort with the cleaning. So things progress much faster than we are willing to treat. And I say that because if we were to be one step ahead, we would need to clean these teeth every 3 months in many of the small breed dogs, which is not feasible, right? You can't come in every 3 months. We aim for every 6 months if there is periodontitis. So my rule of thumb is if we had to extract teeth because of periodontitis, you need to come in at 6 months again to have them cleaned again. It's not enough 1 year. If they've come 1 year or 2 years later, you'll for sure have to extract a lot more teeth. And so how do we prevent this? Can we prevent this from happening? Well, you could start brushing the dog's teeth. And this is, you hear like vets recommend just brush the teeth. I know it can be really difficult, but one of the reasons why it feels difficult is because you're trying to brush the teeth like you would brush your own teeth. You try to open the mouth of the dog, brush like the surfaces, inside, outside, and the dog will start to try to chew on the toothbrush, and it doesn't want to have anything to do with this. So here's the trick, how you get the dog to accept it. You close the mouth. So you hold the mouth closed, like just use 2 fingers, and then you insert the brush on the outside surfaces, and you brush just like 5-6 strokes each side, so 10 seconds each side. That's it. If you can do this every single day, you will prevent disease big time, and it will have a much healthier mouth. So that for the advanced owners and the advanced patients, you can, if they allow you to open the mouth, brush on the inside too. But this is not the important. The most important thing is the outside. The incisors can be a little ticklish, like they don't like you brushing on the incisors too much. So that's also like when you are getting used to it, you can do that. And when should you brush? Well, you can actually brush before food, because it doesn't matter if there's going to be food on the teeth, because dogs and cats, they don't get cavities generally. It's extremely rare to see cavities in dogs and cats because of higher pH value in the mouth and just the anatomy of the teeth. They don't have these occlusal surfaces that we do. They are like mountains. They have spikes. So there's not a lot of places for cavities to form. There's like 4 teeth in the mouth where they can form, and I've seen them maybe twice in 13 years, a cavity in a dog. So it's quite rare. So you can leave food, like you can brush before food, because food can be a motivating factor. They know after I get my teeth brushed, I'll get food. Or place your toothbrush in your hallway. So when you leave the house, remember to just do a quick brush before you take the dog walking. That's also a thing. So incorporating it into your daily routine is key, because if you don't do it every day, it will still progress.
So before we go to some of the other preventative measures that I want to ask you about and get your opinion on, let's go back to talking about the breeds, because we are obviously, I don't know about where you're based, but we see a lot of brachycephalics. We also see a lot of, small dogs, as you made mention of before, about the fact that not only do you see progression because of genetic predisposition and the number of teeth sort of for that amount of space. How often are you dealing with dental issues, and how much worse are they in the brachycephalic breeds?
The brachycephalic breeds have an issue which is called crowding. It means that there's simply not enough space for all the teeth. That's why you see rotation of the premolars. So they are sideways and they are crowding against each other tooth. So that means that in order for a tooth to be healthy, it needs what is called a gingival color. So it means that there should be a healthy gingiva all the way around each tooth, with a space of gingiva between each tooth. In brachycephalics, this space is eliminated because the teeth are squished together, so they are leaning against each other, the teeth. That means that inevitably you will have pockets where bacteria can enter, and periodontitis will start to form. So the brachycephalics are much more prone to both periodontitis, but also things like attrition and when teeth are hitting each other because of the occlusal problems they also have. And so preventing that from an early stage is a nice way to deal with it. Like I always recommend seeing the puppies at 6 months of age. Like have a dental check done at 6 months. If your vet doesn't routinely provide this, then ask for a dental checkup when your dog is 6 months, because at 6 months you will catch these malocclusions that can be detrimental to the patient if you wait like a couple of years until you see the problem. And oftentimes you have to intervene, and if you intervene early, you can have a healthy mouth for the rest of the life. And in brachycephalics, it's often infra-erupted teeth, so the canine teeth are simply not erupting because there's a block. Something is blocking them from erupting. And at age 8-9 months old, they've stopped erupting and they will be stuck there for the rest of the dog's life. And if the tooth is stuck in an infra-erupted position, not fully erupted, food and plaque will get stuck into that deep pocket because the gingiva cannot attach to enamel, which is on the crown, because the crown is buried. So there will be a chronic pocket, and by the age 5-6 years, you may have to extract that tooth. So if you would have removed the blocking tooth, it could be the upper third incisor blocking the lower canine. If you remove that at age 7 months, then you fix the problem for life. So having a dental checkup early on is really, really worth the investment.
Absolutely. I mean, it's really interesting to hear. Obviously, you can identify if you've got a brachycephalic because I think most people are now in tune with it, and they are becoming more and more popular as breed choices because they're endearing and the big eyes and whatnot. But they struggle. They really struggle not only from a respiratory perspective but also with dental issues. Is there a difference in the way that they eat? Before we go to diet, and I'd like to hear your advice or your thoughts on the best diet for managing dental issues longer term. Do they have a different way even of eating because they struggle, from a respiratory perspective? Is that part of the contribution to dental issues?
I believe it's more the crowding issues that is the big contributor to this issue with these breeds. And the way, I think most dogs eat the same way. They kind of swallow the food. They inhale it, some faster than others. If you've ever seen a dog vomit, you see it's like mostly intact kibble that comes up. Some of it is getting chewed, obviously, but most of it is intact. And that's why they cope so well without teeth. Like, it's not a problem for us if we have to extract teeth, and if we have to extract all of their teeth, it's still not a problem, because if they are fed kibble in a bowl every day and not expected to hunt deers or anything, they won't have a problem eating food at all.
That's such a good point. And then, of course, we have the comment, and I'm waiting for your comment on this. We have a lot of comments of feeding bones for the benefit of dental health. We have a lot of owners say, but I feed them bones. And obviously, I can imagine that just makes, you recoil at the risk of fractures and things. But tell me how you approach that conversation with owners who are keen to feed bones.
Feeding bones to help with cleaning teeth and making teeth stronger is really a big false belief. And the staff at PetSmart or other pet stores will tell you that it's good for the teeth. It's absolutely not. There's a huge risk that it will cause dental fractures. And the big upper fourth premolar tooth, the 108 and 208, those are really prone to fracturing. And you see the slap fractures when the buccal aspect of the tooth gets torn off. So bones, whether it's boiled or raw bones, absolutely is a no-go, because they're too hard on the teeth. They will not. They may clean some of the tartar off because of the scraping motion, but the tartar that you see on the crowns is not what is causing the disease. This disease is being caused by the plaque that is inside the pockets. So if all you did was scrape off the visible tartar, you would not have helped this patient at all. And this is why anesthesia-free dentals is not a good idea either, because you get a false sense of security. When you scrape off the visible tartar, you think that you improved the oral health of your pet and that you did a good job, but actually you masked it and you prevented this patient from getting the care it needed. Why would you do anesthesia-free dentistry? There are some different reasons. One is cost. Obviously, it's much cheaper. And there's the fear of anesthesia. Those are the big things that I hear. So you will have clients, loving clients, they love their patients. You will have clients, loving clients that love their pets, and they want to do the best thing, but they don't want to risk the anesthesia. And maybe even their own vet told them, your dog is too old for anesthesia. And to me, this is, it's so extremely rare that a patient is so unstable it cannot undergo anesthesia. So why would somebody say that? It's usually because I'm not comfortable putting your patient under anesthesia with the means that I have. So if you only have injection anesthesia, if you don't have proper monitoring, if I didn't have that, I didn't want to anesthetize all the patients that I have on the table. And I may say something, oh, it's too old for anesthesia. Instead of saying, with the equipment I have, I'm not comfortable, but I will refer you to this vet who is excellent, and they have an anesthesiologist and all this stuff. And they do do a cardiac exam first, do a blood test, do a proper workup of this patient. If you do that, combined with a practice that have proper monitoring equipment and experience with risky patients, then it's absolutely safe for the most part to anesthetize even very old dogs, plus 20-year-old dogs. Some of them live quite long. So I see where the clients are coming from. I know why they are tempted to do this, to have the teeth cleaned by a non-anesthetic procedure. But just be aware that it's absolutely doing nothing for the oral health. It's just masking the disease, and it's not beneficial at all.
Yeah, and so let's explain to owners what dental hygiene and proactive dental care actually does. Discuss the kind of things. Obviously, pain is something that comes to mind, and most owners can associate with, although they're not seeing their pet in pain. Most people, if they've ever had a toothache, can understand that dental health is really critical. But there are things that owners are not aware of in terms of systemic disease and the impact of having dental issues. Can you explain some of that to us and how we would be having that discussion with owners?
Periodontal disease is a chronic inflammation, chronic inflammation in the body. The body has to deal with this every single day. So patients with periodontitis will have chronic bacteria in the bloodstream, and the spleen and the immune system is constantly fighting to get rid of these bacteria. So if you have concurrent disease like diabetes, you will actually experience that you may have a harder time controlling the glucose levels if you have a horrendous mouth full of bad teeth. And once you fix the teeth, the glucose levels are stable again, and they seem to do much better. So from a systemic standpoint, there is a clear correlation between oral disease and also kidney disease and cardiac disease. And you see the same thing in humans. So making sure that the mouth is in good condition also helps the entire body to do much better.
See, I think that's sometimes very difficult for owners. You can't necessarily see it or associate it with it. So, like even with things like cardiac disease, we have some of our vets here who have a particular interest. And one of the things they first start with is, the mouth and the concern that there can be an association. But it's hard for owners to connect those two. And like you say, even, when you've got an unstable diabetic, to think to manage the mouth, we're often thinking there must be an underlying issue. Maybe they've got a UTI, maybe that there's a bacterial infection associated with like the bladder. You're not necessarily thinking about the mouth, and you saying that it just sparks that kind of thought process. So even for us as professionals, so very, very important to remember that.
Such an integral part of the body, and it's so important to examine it at every given opportunity. So train your nurses to, every time they intubate a patient, make sure you do a good check of the mouth. How is the dentition looking? And when you do a vaccination, make sure that you check the mouth properly. When the dog is brought in limping, make sure to check the mouth. Maybe not that's a mistake sometimes I do, because people who do dentistry are so eager to look in the mouth. That's the first thing you open the mouth, and the owner's like, hey, the problem is down here. Don't look in the mouth. And so just maybe start with the problem they came in with, and then look in the mouth before they go. And that's important to remember, because you will find so many things that need help in the mouth.
Very much so. So there is also a benefit, obviously, of having dental radiographs post-procedure. Can you explain what we're looking for when we've actually extracted a tooth, so the owners understand why there may be two charges or there may be additional fees?
Yeah. So taking post-op radiographs after tooth extraction is absolutely paramount to both check your work. Did you do a good job? Looking for root tips. This is a major reason, because you may extract a tooth and it looks perfectly fine. You see, oh, this root tip is nice and round. And then you take the x-ray and you see, no, you actually didn't get everything out as we thought. Sometimes when you take the post-op x-ray, you will see part of the root, not the root tip, but you will see further up towards the crown. You may have missed a little piece that you drilled into. You may have a piece of your burr, dental burr, in the alveolus still that you didn't see, broke off, and then so these things you have to check it. Once you start to do X-rays, or you will get much better at dentistry, because you can always check your work. And so the main reason is pretty much making sure that you're not leaving root tips behind. And this has also been proven in a nice study by Dr. Morten Hinge, who's a board-certified dentist, and he examined a bunch of extraction sites after teeth and found lots of root tips that vets thought they got out. So even if you think you got everything out and you're absolutely sure you got everything out, still take an x-ray, because what happens if the dog goes home and there's a problem? You have no way to prove to this owner that you actually removed the entire tooth, that you actually, when it left you, there were no problems. I have an example of a dog that I extracted a tooth. It was a small breed dog, and those are prone to jaw fractures. When they have very bad teeth, the jawbone can get so thin that the jaw can break just from periodontal disease. So I had a patient that I took out a lower molar, and the jawbone was not very thick. And I took the post-op x-ray, everything was good. I sent it home. It came back a month later to have additional dental work done. And I took an x-ray of that side again, and I saw the bone had actually fractured, but started to heal again, which was almost like a miracle. It started to heal again. But I knew that when I sent this dog home, the jaw was fine, because I took that x-ray. What if they went to another veterinarian in the meantime? They took an x-ray of this and they saw a fractured jaw, and you didn't take a post-op. You would have a big problem explaining it was not you who broke this jaw. See, so it's from an insurance perspective to also document what you did. This is so important. So it's not just because we want to charge extra, or we want to double check something that's not necessary. I've been surprised multiple times where I thought it's good. I took this x-ray because I thought I had everything, but actually there was a piece of something left. Also, a piece of scalpel broke in the alveolus, and things like foreign bodies, objects can be in there. And again, for just, documentation, proper documentation.
That's great advice. And obviously, you have spent a huge amount of time educating vets on, like you started off saying, extracting teeth faster. But are there any times where you have had to say to an owner, we need to do another procedure, whether there is a time limitation, or you take the dental x-rays? Even for us as GPs, do you advise that we say this may have to be done on another day, that I can allocate, enough surgical time, so that we are not rushing, we're not feeling under pressure, because that can be really off-putting. You think you're getting a scale and polish, and then the next thing you see that there are multiple extractions, and you're going, I don't have enough time to do this.
Absolutely. I actually advise to do it. At least buy yourself some flexibility, because you never know what you're going to get. You never know if it's 1 tooth, 2 teeth, or 20 teeth that need extractions, or no teeth. You have no clue. And trying to stage it based on the awake oral examination simply doesn't work. So I don't advise doing that either. So what I do is I tell the owner in the morning, so today we're going to do a cleaning, a polishing, oral examination, a full mouth x-ray. If there are teeth that are bad, I do have a little bit of time today to deal with some of them, but if we need to do surgery, we will make another appointment, so you can come back and have that done. In that way, the anesthesia will not be super long. The owners don't want super long anesthesia, so they agree on that. And I want to have enough time to do a good job with your dog, and the owners want you to have enough time to do a good job. So the pressure that is put on some of these vets out there, that you have to finish everything in one go, this is absolutely inhumane. This is not possible. You cannot finish everything in one go. And let's tell the owner that it's not a failure if you have to split a procedure. It's not because you're a bad vet or you're not fast enough. No, we are dealing with ankylosed teeth, tooth resorption, teeth that are like falling apart as we try to get them out. We are dealing with microsurgery, and most of us are not trained really, really well to be comfortable doing a lot of surgical extractions. So things take time, and I would recommend setting aside 2 hours per dental patient if you want to be able to both extract some teeth, but also be able to send it home and come back later. Some practices, they do it in 2 stages always. They actually say, today is only cleaning diagnostics. If we find anything that needs to be done, you have to come back in a second procedure. And I see this can be frustrating for owners. And my recommendation is in the middle way. Like, try to do whatever you can. Try to finish whenever feasible, possible within a reasonable time frame. But if you can say, okay, I have 6 more teeth to go, and the next patient is waiting, and I mean, when you are able to just say, okay, we'll wake it up, we'll have it come back, and you already told the owner in the morning that you may have to do that, then it's not a failure. It's just setting expectations, setting clear expectations, and setting clear, healthy boundaries. You are not supposed to fix everything at once. Try to go to your own human dentist and have an oral examination. What do they do if they find a cavity or a tooth that needs extraction? Do they do it right away? Absolutely not. They will not dream of doing that. So the clients they know this, but the objection is we don't want to pay for 2 anesthesias. Well, you can say, what I typically do is I say, well, it's not going to be more expensive for you. We kind of just split the bill. split the bill. We don't charge induction at the second visit. That could be a way to manage it. In some countries, like, you have to charge everything. You cannot give that type of discounts, but find a way that works for you. And if you still have to charge double for anesthesia, well, then that's what you have to do. But you just make sure that what I do is I make the final estimate on day one. So I say, we found like 10 teeth that need extraction, and this is going to cost this amount to fix. Whether we fix it in one go or two goes, it will not affect the final price. This is the way how I do it. Maybe it's not feasible for all clinics, but I think this is what really works to communicate to the owner. It's not about like charging double. We have this amount of work that needs to be done. It's going to cost approximately this. How we get to that result, it may be in one go, it may be in two goes. It's up to the anesthesia. Safety is important. We don't want it to be super long, and we don't want to fatigue ourselves, because if you've been struggling with a root tip for the past 2 hours, you're not doing your best. You're not feeling your best, and you may want to break.
Yeah, and they may be compromised the remainder of the procedure just because we are human.
Yeah.
My final question to you, because I know we're running out of time, and I do want you to talk about where vets in particular, or nurses who are interested in the subject, can find more information about some of the work that you're doing for them. But my final question is there ever any merit in, when you're seeing these really foul-smelling, clearly a huge bacterial component to the mouth, before they are going to come in or can schedule the procedure of providing medication just to see them through? Is that something that you ever do?
I will provide NSAIDs sometimes when they wait for the upcoming surgery, and if it's really infected in the mouth, I will provide some chlorhexidine they can apply topically in the mouth. I don't prescribe antibiotics before or after the surgery. I've been doing this for 13 years, and for the past, in the beginning, we prescribed antibiotics for everybody because we didn't know better. But the past 9 years, I can count on one hand how many patients got antibiotics, because you have to remember that these bacteria has been in that. When you see this patient, the bacteria has been there for months and sometimes years. So prescribing antibiotics has no real benefit of treating this. It simply cannot reach these bacteria because they are gathered into a biofilm, and this biofilm requires like up to 1,500 times the dose. So imagine, say, you have to take these 1,500 pills twice a day to treat it. It doesn't make sense. So I always explain it like this. We can deal with the pain with NSAIDs and topical antiseptics. This helps. If you have an abscess, like a true abscess with pus coming out and really swelling, yes, sometimes antibiotics can help with like reducing that. But for generally speaking about just the tartar and infection in the mouth, this is all you need. And sometimes prescribing NSAIDs leading up to the procedure can remind the owner that there is a painful condition that needs to be treated, because sometimes they can forget. They say, oh, now it's fine again. We'll cancel the appointment. So that's what I would do. And also after the surgery, no antibiotics, just antiseptics topically. It really helps a lot with the healing. So there's always going to be exceptions if you have truly immunocompromised patients. So if you have patients on high doses prednisolone, if you have like uncontrolled diabetes, there are certain diseases where it would be beneficial to do antibiotics intraoperatively, not before, not after. So in those cases, the only times that you actually prescribe antibiotics is during surgery. So you give it IV at induction, and every 2 hours, that's it. That's what you need for those type of patients that actually need it. But 99.9% of all dogs and cats, they don't need antibiotics. It has no benefit. all it does is disturb the microbiome and cause resistance problems.
This has been a fascinating conversation. I'm so grateful that you've shared all of this with me and with the listeners. If people want to get hold of you, where do they find you? How can they find more information about the work that you're doing?
Yeah, I'm quite active on Instagram, and I have probably the largest account talking about vet dentistry, around 70,000 followers. So you can find me on Morten Vet Dentistry on Instagram. I have a YouTube channel where I do longer form, step-by-step surgical videos. If you want to follow along, prepare for your next surgery. And if you want to dive deeper and really get confident and fast with dental patients, then I also have an option to work directly with me. I have a dental coaching program where people can get my direct help.
That's incredible. Well, I'll certainly be telling my colleagues about you, and I'm really, really grateful that you've given our pet owners a bit of an insight into why they should be keeping up with their pets' dental health, and definitely going to be recommending more routine dental care, because I think, that yearly thing has been just something that has been a practice policy rather than actually being aware that we should be making the recommendation before that. So I've certainly learned a lot today. Thank you.
Excellent.
Thank you, Dr. Morten.
Oh, you're welcome.
Very cool. Thank you so much for tuning into today's episode on the Paws and Effect podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Jackson the Jack Rossi here, and boy, am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.